My name is Yolanda Edrington. I'm the Community and Patient Engagement Supervisor. Hamilton Health Center has been serving the greater Harrisburg community since 1969. We're the only federally qualified health center in Dauphin County. Hamilton Health Center is truly a one-stop shop medical mall. We provide adult medicine services, pediatric, women's health, dental, nutrition. We have our WIC offices, and also social service programs like our HIV/AIDS department, which is our HOPE program. Our HOPE stands for HIV, Outreach, Patient, and Empowerment. And what that means is we're a primary care physician for our HIV/AIDS positive patients. We provide education to the community, and that's through our outreach initiatives. We also provide testing, free testing here at Hamilton Health Center from 8:30 to 4:30 Monday through Friday, so don't forget about that. You can come on in. We provide outreach and education to the community. We come to where you are at. We come to different locations within the Harrisburg area to bring information and awareness about how the community is affected by HIV/AIDS in the Harrisburg city area. We also provide counseling with our testing services here within the whole program.
According to the Center for Disease Control, in 2013, an estimated 1,419 adults and adolescents were diagnosed with HIV in Pennsylvania. Pennsylvania ranked 10th among the 50 states. 54.5% Black, 28.2% white, 12.9% Hispanic Latino.
My name is Regina King. I'm the Chief Clinical Officer in Hamilton Health Center.
So I'm Dr. Arthur Williams. I'm the Medical Director for the Hamilton Health Center's HOPE program, which is our HIV program.
Cecilia Ferris, Youth Adolescent Program Coordinator.
I would say the lack of awareness, I would say the lack of education, and I would say the lack of knowledge, especially amongst our youth and our elderly. I think that youth think they're superior, that they can't get it, they can't contract this disease. And I feel as though with our elderly population, they never really had to worry about a lot of infectious diseases when they were younger, or whatever infectious diseases they did get when they were younger, you got a pill and it went away. The most important thing they worried about was pregnancy. So HIV/AIDS is the furthest things from their mind. So I think that, that lack of awareness could be detrimental to our community.
I think the single most, I'm going to give you two, actually. So one is the fact that people don't feel that HIV is a problem still here in Harrisburg, and so they're not getting tested. And the issue is we have people here that are positive in Harrisburg, we have people here that don't know they're positive in Harrisburg, and that everyone needs to get tested. The CDC recommends that everyone get, from the age of 13 to 64, get tested. I recommend everybody get tested once a year, based on two things. A lot of people aren't using condoms. That's the second piece. This thing we talk about, one of the most important issues in Harrisburg is people are not using condoms, they need to use condoms. And then understand that if you don't use a condom, you then need to get tested for HIV within 3 to 6 months after each encounter.
I think with our youth, it's very important that we continue to encourage them to be responsible about their sexual and reproductive health. It's very important that when they do come in to see us for resources or testing for STDs, that we encourage them to also take an HIV test as well. Anyone who is sexually active and having unprotected sex could be exposed to AIDS or HIV. So we want to make sure that we are providing the same resources as we do for adults for our youth who are sexually active.
I provide the outreach services within HOPE. So for me, my experience is the lack of awareness within the community on how we are all affected by HIV/AIDS. Whether you're positive or negative, we're all affected by HIV/AIDS because it's a part of our community. It's a part of everyone that's here, businesses, family, all of that. So for me, within outreach, our biggest thing is to get out to the community and give awareness, education, so they know where people know where to go for testing, where to go for education, or just where to go to get their questions answered. So awareness to me is the biggest concern in this area, because if we are aware, then we would come and get tested. We would know that we need to go into treatment right away. We would know all of these things if we were aware of our own status.
The Centers for Disease Control and Prevention has projected that if current trends persist, half of Black men who have sex with men and a quarter of Latino MSM will become HIV positive during their lifetimes. CDC researchers analyzed HIV diagnosis and death rates between 2009 and 2013 to conduct the first ever projection of the lifetime risk of contracting HIV among certain populations. The findings were presented at the 2016 Conference on Retroviruses and Opportunistic Infections in Boston.
I think we have to start with continuing to collaborate with other community-based organizations, continue with the community outreach that we do currently, as well as continuing to participate in community health events. I think one of our biggest struggles is getting into the faith-based community. I would like to enhance that relationship in the future. I think that would be our starting point.
I think, issues such as this are amazing in reference to having videos like this to let people know about HIV. They still hear. What happened was that once HIV stopped being a death sentence for people, we stopped hearing about it on the media, and so people stopped getting tested. So getting back into the media, I think we now have the advent of the social networking that happens through cell phones and things like that. But that's also part of the problem, in that people are actually doing what they call hookups, or actually meeting and having sex anonymously through these apps such as Tinder and Grindr. And in light of that, people need to be aware, if you're having unsafe sex, you need to be sure to use a condom.
Well, for youth, it's very important that we are relatable. It's very important that we provide services for them that are team friendly and encourage them to be involved into their reproductive health. We continue to provide prevention education, which is our #1 key component to this program, as well as provide support and treatment with any STD results.
I think we do that really well within our outreach initiatives through HOPE. With Hamilton Health Center having such a strong community connection to Harrisburg City, that puts us in a great position to be able to use our connections through Hamilton to boost awareness about HIV/AIDS through our HOPE program. And we use those connections that we've learned through the other services within Hamilton Health Center to continue to build the HOPE program and what people know about HIV/AIDS within the community.
According to the CDC in 2013, the STD rates in Dauphin County are as follows: 598.2 people per 100,000 people had chlamydia, compared to 431.6 people per 100,000 people in the state of Pennsylvania. 4.1 people per 100,000 people in Dauphin County had early latent syphilis, compared to 3.8 people per 100,000 people in the state of Pennsylvania. 195.9 people per 100,000 people in Dauphin County had gonorrhea, compared to 120.8 people per 100,000 people in the state of Pennsylvania. 393 people per 100,000 people in Dauphin County had HIV, compared to 292.3 people per 100,000 people in the state of Pennsylvania. Every year, World AIDS Day events take place across the country to raise awareness and show support for people living with HIV and AIDS. Let's continue these efforts throughout the year and encourage testing and education. Awareness is key.
That we've been serving the Harrisburg and surrounding areas for more than 10 years, that we are very dedicated to the job that we do. We're very passionate about HIV/AIDS. We provide great clinical support services, education, awareness, and that we provide these services in a very culturally sensitive manner.
That we're here to serve everyone, whether they have insurance or not. We are a really solid team. We've been here for a while, treating people, and very successful in getting people's viral loads to undetectable levels and their CD4 counts going up. Or actually, basically, what that means is getting the HIV virus down to a level where actually a person's immune system can take over and control it. Can't cure HIV yet, but we can definitely get it under control and make it a chronic disease where people take their medication every day, they can live a normal life.
The Team Resource Center is very team friendly. We provide a lot of education in the Resource Center as well as group education in schools. We're also providing STD testing, treatment, as well as counseling for pregnancy options. We also do a lot of linkage to care, so we're collaborating with a lot of outside agencies, making sure that the youth are aware of resources in their community that they do qualify for. We also want people to know that this issue is not going away. Youth who are sexually active are continuing to test positive for these STDs and HIV in our communities. And what we want to do is continue to raise awareness on this issue, as well as provide support and counseling to those in need.
I would like for the community to know that we are there for them, that they can come to the HOPE program and get all of their questions answered. Whether positive or negative, we are here for the community. And that's my biggest thing with the initiatives and outreach, to get out and make sure that people are aware where they can go, what role we play, and that you don't have to be positive to contact us to be able to come in to get the information that you need. Whether it be information about condoms, information about safer sex practices, whatever those questions are, I want them to know that they can come to the HOPE program within Hamilton Health Center and be able to get those questions answered.
Get tested. The earlier treatment begins, the more likely a person can have a normal lifespan and live a long and fruitful life.